Imagine this. You're in your 70s, feeling that familiar ache in your knees or hips after a short walk. You brush it off as just getting older. But did you know that this so-called normal joint pain is a red flag for cartilage loss, which affects over 32 million Americans, with rates skyrocketing after 70? According to the Centers for Disease Control and Prevention, osteoarthritis, the leading cause of this pain, leads to more than 1 million joint replacement surgeries each year in the U.S. alone. If ignored, you could lose your ability to walk unaided, climb stairs, or even enjoy time with grandchildren. The fear is real. Studies show that untreated cartilage degeneration increases fall risk by 50%, potentially landing you in the hospital or worse. But what if one simple food could halt this decline? Stay with me. Today, we'll uncover the science and a proven way to protect your joints before it's too late. To guide us through this, I'm drawing on the expertise of Dr. Elizabeth Thompson, a board-certified rheumatologist with over 25 years of clinical experience specializing in aging and joint health. Dr. Thompson has treated more than 5,000 patients in her career, many over 70, and her preventative nutrition strategies have helped 80% of them report significant reductions in joint pain and improved mobility without resorting to surgery. She's published in top journals like the Journal of Rheumatology and collaborates with leading research institutions on dietary interventions for osteoarthritis. With her insights, we can trust that the information here is grounded in real medical science, not hype. Let's dive into the science behind why joint pain after 70 isn't just normal, it's a sign of trouble brewing in your body. Cartilage is the smooth, protective tissue that cushions your joints, acting like a shock absorber. As we age, our bodies produce fewer chondrocytes, the cells responsible for maintaining and repairing cartilage. This natural slowdown is exacerbated by chronic low-grade inflammation, oxidative stress from free radicals, and hormonal changes, all of which accelerate cartilage breakdown. Picture it like this. In your younger years, your joints are like well-oiled machinery, but after 70, inflammation triggers enzymes like matrix metalloproteinases, or MMPs, that literally eat away at the cartilage matrix, thinning it out and exposing bone ends. This leads to pain, swelling, and stiffness. A study in the journal Arthritis and Rheumatology found that cartilage volume decreases by up to 2% per year in seniors with early osteoarthritis, doubling the risk of needing surgery within 5 years if unchecked. Understanding this sets the stage for how targeted nutrition can intervene by reducing inflammation and supporting cartilage repair at the cellular level. Now, before we get to the solution, it's crucial to debunk common mistakes that many seniors make, unknowingly speeding up cartilage loss. These aren't just bad habits, they're backed by science as direct contributors to joint degeneration. First, consuming ultra-processed foods like packaged snacks, frozen meals, and fast food. The scientific danger? These foods are loaded with additives, trans fats, and refined carbs that spike systemic inflammation, promoting the release of cytokines, proteins that attack healthy cartilage and accelerate its breakdown. A surprising study from the Osteoarthritis Research Society International, published in 2025, found that higher intake of ultra-processed foods was associated with 20% thinner knee cartilage and a 35% increase in pain scores over 2 years in adults over 65. Let me share a patient story from Dr. Thompson's practice. Take Margaret, a 72-year-old retiree who relied on microwave dinners and chips for convenience. Within a year, her mild knee pain escalated to severe osteoarthritis, confirmed by MRI showing significant cartilage erosion. She ended up needing cortisone injections and physical therapy, regretting not cutting out those processed items earlier. It cost her months of limited mobility and unnecessary suffering. Second, overindulging in sugary drinks and sweets, such as sodas, candies, and baked goods. The danger here is that excess sugar triggers advanced glycation end products, or AGEs, that stiffen cartilage and make it more prone to cracking and loss. Research from the American Journal of Clinical Nutrition revealed that seniors consuming more than 50 grams of added sugar daily had a 40% higher risk of rapid cartilage degradation and osteoarthritis progression compared to those with lower intake. Consider John, a 75-year-old golf enthusiast Dr. Thompson treated. He loved his daily soda and desserts, dismissing them as harmless treats, but his scans showed his hip cartilage had thinned by 25% in just 18 months, leading to constant pain that forced him to give up his hobby. He faced the prospect of surgery until he made changes, but the damage was already done, highlighting how these everyday choices can rob you of your active life. Thankfully, there's hope. The one food that stands out in scientific studies for preventing cartilage loss after 70 is strawberries. Yes, those vibrant, everyday berries packed with powerful compounds that can safeguard your joints. The scientific benefit: strawberries are rich in antioxidants like anthocyanins and ellagic acid, plus vitamin C, which combat oxidative stress and reduce inflammation at the joint level. They specifically inhibit enzymes like MMP3 that degrade cartilage while promoting collagen synthesis, the building block of healthy cartilage. This dual action helps preserve cartilage thickness and elasticity, slowing the degenerative process that leads to surgery. Successful study data backs this up. A randomized controlled trial published in Nutrients in 2017 involved obese adults over 50 with knee osteoarthritis. Participants consuming the equivalent of about 500 grams of fresh strawberries via freeze-dried powder daily saw significant reductions in cartilage degradation biomarkers, including a 30% drop in MMP3 levels and decreased inflammation markers like TNF-alpha after just 12 weeks. Pain scores improved by 24%, and follow-up imaging showed slower cartilage loss compared to the control group. Another study in the Journal of Medicinal Food confirmed that strawberries lowered constant osteoarthritis prevalence from 24% to 14% in similar patients, with benefits persisting for months. Now for your specific action plan. Make strawberries a daily staple, simple and effective. Start by aiming for 1 to 2 cups of fresh or frozen strawberries each day, which provides a therapeutic dose without overwhelm. Blend them into a morning smoothie with yogurt for easy digestion, or add them to oatmeal or salads. If fresh aren't available, opt for freeze-dried strawberries, about 50 grams daily, as a supplement alternative, but always choose unsweetened varieties. Track your progress. After 2 weeks, note any reduction in joint stiffness. Consult your doctor if you have allergies or are on blood thinners, as strawberries can enhance certain effects. Consistency is key. Incorporate this habit daily to build those protective benefits over time. If this information is resonating with you, please take a moment to like this video. It helps us reach more seniors like you who deserve to live pain-free. Hit that subscribe button and turn on notifications so you never miss our content on nutrition, aging, and preventative health tailored for those 60 and beyond. In the comments below, share your age or a specific joint concern you're facing. We read every one and often feature them in future videos. Remember, this channel is dedicated to empowering you with evidence-based strategies for longevity and vitality. In summary, by steering clear of ultra-processed foods and excess sugars and embracing strawberries as your joint-protecting ally, you can halt cartilage loss, reduce pain, and avoid the surgeon's knife. The benefits are profound, preserving your independence so you can garden, travel, or play with loved ones without limitation, extending your quality of life for years free from chronic discomfort, and slashing medical bills by preventing hospital visits and procedures that cost seniors an average of $50,000 per joint replacement. Don't let normal pain steal your golden years. Take action today with this simple, science-backed change. You've earned a vibrant, active life, and it's within reach. Subscribe now for more life-changing tips, and we'll see you in the next video.